Hello everyone. Welcome back to Health, a channel dedicated to tips, advice, and everything health related. I'm so happy to have you here today. Before we dive into today's video, make sure to like, share, and subscribe to our channel. It really helps us bring you more of the great content you love and gives us the motivation to keep making informative videos like this. In today's video, we're diving into some unexpected yet incredibly common habits that might seem harmless at first, but could be secretly sabotaging your health. I'm talking about everything from the way you wake up to the first thing you do after your alarm goes off. And guess what? Some of these habits you're doing right now could be putting your brain, heart, and overall well-being in danger, without you even realizing it. But don't worry, we've got the solution, and I'll show you exactly how to protect yourself with just a few simple changes. Jumping out of bed too quickly. A hidden stroke risk. For many seniors, it's instinctive to jump out of bed as soon as they wake up, eager to get the day started. But this seemingly harmless habit can have serious consequences. After a night's rest, your body is in a relaxed state. Your blood pressure is low, your heart rate is slower, and your blood vessels are more relaxed. Suddenly standing up too quickly can cause a drop in blood pressure, a condition called orthostatic hypotension, which can lead to dizziness, fainting, or even falls. For seniors with narrowed arteries or heart conditions, this sudden movement can disrupt blood flow to the brain, increasing the risk of stroke. Have you ever felt lightheaded or dizzy when you get up too quickly? Many people simply brush it off as part of aging, but these episodes should not be ignored. I recall one of my patients, Mrs. Thompson, in her early 70s. She came to me complaining of dizziness every morning. She always rushed to get out of bed, thinking it was just a normal part of getting older. However, after we discussed her symptoms, I realized that her arteries had started to narrow with age. This meant that her body was struggling to adjust to the sudden movement, which led to dizziness. Similarly, Mr. Allen, a patient in his late 60s, was always in a rush to start his day, especially when he was busy taking care of his grandkids. One morning, he jumped out of bed too quickly, felt dizzy, and fell back onto the bed. He didn't think much of it at first, but after more incidents, we found out that his blood pressure spiked and his circulation struggled to keep up with the sudden change in position. This put him at risk of a much more serious health issue. The solution is simple. Give your body a moment to adjust before you stand up. Sit on the edge of your bed for a few seconds and take a few deep breaths to allow your blood pressure and circulation to stabilize. This small adjustment can prevent dizziness and significantly lower the risk of strokes or falls. I personally started this practice after experiencing a few dizzy spells in the mornings. Now I always take a moment to sit up slowly before getting out of bed, and it's made a big difference in how I feel throughout the day. So, next time you wake up, ask yourself, do you rush to get out of bed, or do you take a moment to listen to your body? Taking just a minute to transition slowly can help you feel better and reduce your risk of stroke in the long run. Skipping water in the morning. A stroke risk you might be overlooking. One of the most commonly overlooked habits is not drinking water first thing in the morning. After a full night's sleep, your body has gone several hours without hydration. Since your brain is about 75% water, it's naturally dehydrated when you wake up. If you don't rehydrate right away, your blood thickens, blood pressure rises, and circulation to your brain suffers. This combination can significantly increase your risk of having a stroke. Do you ever feel sluggish or foggy when you first wake up? That's your body telling you it's dehydrated, and it's more than just morning grogginess. Dehydration causes your blood to thicken, making it harder for your heart to pump efficiently. This puts additional strain on your body, especially your blood pressure, and limits the oxygen and nutrients that reach your brain. For seniors, this can be even more dangerous, especially for those with existing blood pressure issues or poor circulation. These factors, combined with dehydration, create the perfect storm for a stroke. I remember a patient, Mr. Johnson, who was in his late 60s. He often skipped drinking water in the morning, going straight for coffee or tea. He thought it would give him the energy boost he needed. One day, after feeling dizzy and having a mild headache, we discussed his routine. That's when we realized that by not hydrating first thing in the morning, he was essentially making his body work harder than it needed to. His blood pressure was higher, and circulation was slower because his body hadn't gotten the water it needed after hours of sleep. We made a simple change. He started drinking a glass of water right after waking up, before anything else. After a few weeks, he felt more energized and experienced fewer episodes of dizziness and headaches. Does that sound familiar to you? Are you skipping water in the morning, thinking that coffee or tea is enough? In reality, caffeine can actually dehydrate you further, making the problem worse. Drinking water first thing is the best way to kickstart your body's natural processes and improve circulation. The solution is simple. Drink a glass of water as soon as you wake up, preferably at room temperature. It's a quick habit to develop, but it can have a huge impact. Hydrating right away helps thin the blood, improve circulation, and support brain health. For seniors with high blood pressure or a history of stroke, this habit is especially important. It helps regulate blood pressure and ensures your blood is flowing freely throughout your body. Let me ask you, how often do you start your day with water instead of coffee or tea? It might seem like a small change, but trust me, it can make a big difference in protecting your brain health and reducing your stroke risk. It only takes a minute but can have long-lasting benefits. Personally, I've noticed a big difference since I started drinking water as soon as I wake up. I feel more clear-headed, have more energy, and my blood pressure stays more stable throughout the day. It has become a part of my morning routine that I swear by, and I encourage all my patients to do the same. So, tomorrow morning, try this simple change. Drink a glass of water as soon as you wake up. Your body and brain will thank you for it. Consuming a high-sodium breakfast. A hidden risk you might be overlooking. Many seniors unknowingly consume breakfast foods that are high in sodium, which can have a significant impact on their health. Foods like cereals, instant oatmeal, processed breakfast meats like sausage or bacon, and even store-bought bread are often packed with salt. While these options may seem quick and easy, they can contribute to high blood pressure and increase the risk of stroke over time. The worst part is that many of these products have hidden sodium, making it easy to exceed the recommended daily limit without even realizing it. Have you ever looked at the sodium content in your breakfast? Most people don't realize how much salt is in everyday breakfast foods. For example, an instant oatmeal packet might sound like a healthy choice, but many of these packets contain not only sugar but also significant amounts of added salt. Processed breakfast meats like bacon or sausage are often loaded with sodium, contributing to hypertension if consumed regularly. Even store-bought bread, which we often consider a staple, is packed with salt. I had a patient, Mr. Harris, in his early 70s, who thought he was eating a heart-healthy breakfast every day. His routine consisted of a bowl of instant oatmeal and a couple of slices of toast. However, after reviewing his health and diet, we discovered that he was consuming much more sodium than he realized. His blood pressure was elevated, putting him at higher risk for heart disease and stroke. After we worked together to swap his typical breakfast for lower sodium options, like fresh fruit, boiled eggs, and unsalted oatmeal, his blood pressure dropped, and he felt a lot better over time. Does that sound familiar to you? Do you think your breakfast is healthy, only to realize it's loaded with salt once you check the labels? Many so-called heart-healthy products can still contain far more sodium than you expect, and over time, this can take a toll on your health. Let me ask you, how often do you check the sodium content in your breakfast? Are you aware of how much salt is hiding in your food? Even small changes in what you eat can have a big impact on your health. The solution is simple. Switch to lower sodium breakfast options. Choose foods like fresh fruit, boiled eggs, unsalted oatmeal, or whole grain toast with avocado. These are not only lower in sodium, but also rich in nutrients that support heart and brain health. By making these small changes, you can dramatically reduce your sodium intake and lower your risk of hypertension and stroke. I made this change in my own life after realizing how much sodium I was consuming in my breakfast. I used to eat breakfast sausage with my eggs, but after learning about the risks of high sodium, I switched to boiled eggs and fresh fruit instead. It's a small adjustment, but it's made a big difference in my energy levels, and my blood pressure has been much healthier as well. So next time you're preparing your breakfast, ask yourself, is it high in sodium? Are you making the healthiest choices for your heart and brain? Small changes, like choosing fresh fruit or unsalted oatmeal, can significantly reduce your stroke risk and improve your overall health. Drinking too much coffee on an empty stomach, a risk you might be overlooking. For many of us, especially as we get older, coffee is a beloved part of our morning routine. It's comforting, energizing, and often the first thing we reach for when we wake up. However, drinking too much coffee on an empty stomach can actually be harmful, especially as we age. How often do you wake up and immediately grab that first cup of coffee? While it may seem like that first sip gives you an energy boost, it's important to understand the impact on your body. Caffeine triggers the release of adrenaline, which speeds up your heart rate and causes blood vessels to constrict. This leads to a spike in blood pressure, and for seniors, especially those with high blood pressure or heart issues, it can trigger strokes or cause irregular heart rhythms, known as arrhythmias. I recall a patient of mine, Mr. Roberts, who was in his late 60s and drank several cups of coffee every morning, often before eating anything. He believed that his coffee was essential to feeling alert and ready to start the day. But after one morning when he drank his usual 3 cups, he started feeling his heart racing and experienced tightness in his chest. At first, he thought it was just a side effect of the caffeine, but when we checked his blood pressure, it was dangerously high, and his heart rhythm was irregular. This was a clear sign that his coffee habit was negatively affecting his health. After we adjusted his routine, cutting back on his caffeine intake, and making sure he ate a light breakfast before drinking coffee, his symptoms significantly improved. Does this sound familiar to you? Have you ever experienced jitteriness, heart palpitations, or an uneasy feeling after drinking coffee first thing in the morning? It might seem like just the usual effect of caffeine, but for those with high blood pressure or other cardiovascular concerns, it's your body's way of signaling that it's under stress. The solution is simple. Limit your caffeine intake to 1 moderate cup per day and avoid drinking it before eating breakfast. Instead, start your morning by hydrating with water to replenish fluids lost overnight. This helps your body wake up and function more effectively. After that, have a light, healthy breakfast, something with protein or fiber to help stabilize your blood sugar levels before you introduce caffeine. When you do drink coffee, keep it in moderation and avoid excessive sugar or creamers, which can also contribute to other health issues like inflammation and blood sugar spikes. Personally, I've made this change myself. I used to drink multiple cups of coffee first thing in the morning, but once I learned about the risks, I switched things up. Now, I hydrate with a glass of water, have a small balanced breakfast, and only have one moderate cup of coffee afterward. This change has made a huge difference for me. I feel more balanced throughout the day, my energy is more stable, and I don't experience the jittery feelings I used to get. Let me ask you, how many cups of coffee do you drink each morning? Do you find yourself depending on it to get going, even on an empty stomach? It's important to pay attention to how your body responds to what you consume, especially in the mornings, when your body is transitioning from rest to activity. Ignoring morning dizziness or weakness. A warning you shouldn't ignore. Many seniors experience dizziness or weakness when they first wake up in the morning, but often dismiss it as just part of aging or the result of poor sleep. However, these symptoms can actually be a sign of something more serious, such as poor circulation, rising blood pressure, or even an early warning of a mini stroke or transient ischemic attack, TIA, which can precede a full stroke. Have you ever felt lightheaded or weak when getting out of bed in the morning? It's easy to write it off as a normal part of aging, but these could be signs that your brain isn't getting enough blood or oxygen. When this happens, it may indicate circulation issues or rising blood pressure, both of which are common as we get older. If you've been ignoring these symptoms, it's time to start paying attention. For example, I had a patient, Mrs. Patterson, in her late 70s, who would frequently feel lightheaded when she first stood up. She assumed it was just due to a lack of sleep or getting older. She ignored it for months, thinking it wasn't a big deal. One morning, she stood up quickly, lost her balance, and fell, injuring her hip. That's when we took a closer look at her symptoms. After some tests, we discovered she was experiencing a transient ischemic attack, TIA, a mini stroke. TIAs don't cause lasting damage, but they are a clear warning that a larger stroke could be coming. Unfortunately, Mrs. Patterson didn't take her symptoms seriously, and it could have been prevented if she had. Do you ever feel dizzy or weak in the mornings and just push through it, thinking it's nothing? It's common to ignore these signs, but they could be early indicators of something much more serious. TIAs are often referred to as mini strokes because they don't cause long-term damage, but they're a strong signal that a larger stroke could be on the horizon. That morning, dizziness could be your body's way of warning you to take action before it's too late. I also treated Mr. Grant, another patient in his 70s, who had been experiencing occasional dizziness in the mornings. Like many people, he thought it was just part of getting older. However, when he started noticing additional symptoms like weakness on one side of his body and slurred speech, we took it seriously. After testing, we found that Mr. Grant had experienced several mini strokes over the past few months. Thankfully, they didn't cause lasting damage, but it was a wake-up call. His symptoms were early warning signs of a major stroke that could have happened if he hadn't gotten help when he did. How many times have you felt dizzy or weak and simply brushed it off? It's easy to convince yourself that these things are just part of aging, but your body may be telling you something more. Listening to your body and taking those early warning signs seriously can make all the difference. If you experience dizziness, weakness, or confusion in the mornings, don't ignore it. Track the symptoms, talk to your doctor, and get checked out. Early intervention can help prevent a stroke or other serious complications. In addition, managing your blood pressure, staying active, and staying hydrated can help prevent these symptoms in the future. skipping medications or taking them incorrectly. A risk you shouldn't ignore. Millions of seniors skip or take their medications incorrectly, often without realizing the potential consequences. This is especially dangerous when it comes to critical medications like heart medications, blood thinners, or cholesterol-lowering drugs, which are essential for stroke prevention. Missing doses or taking them incorrectly can significantly increase the risk of stroke, heart attack, and other serious health problems. How often do you forget to take your medication or take it at the wrong time? It may seem like a minor issue, but when it comes to managing conditions like high blood pressure or cholesterol, even missing one dose can lead to severe consequences. For example, one of my patients, Mr. Jackson, was prescribed blood thinners to prevent clots. He once skipped his medication and thought nothing of it. A few days later, he suffered a stroke. If he had stayed on track with his medication, it might have been prevented. Another common problem is when seniors adjust their own medication dosages. For instance, Mrs. Green lowered her blood pressure medication because she was feeling dizzy, thinking it would help. Unfortunately, this led to dangerously high blood pressure and put her at risk of a stroke. Have you ever changed your medication dosage without consulting your doctor? It's important to always talk to your healthcare provider before making any adjustments to your treatment plan. The solution is simple. Set a consistent routine for taking your medications. Use pill organizers, set alarms to remind you, and if needed, ask a family member or caregiver to help. Always take your medications with water to ensure proper absorption, and never adjust your dosage without consulting your doctor. Personally, I've found that using a pill organizer and setting daily reminders has helped me stay consistent with my medications. It's a small change that can make a huge difference in preventing serious health risks. How do you keep track of your medications? Creating a routine can help you avoid dangerous mistakes and lower your risk of complications like stroke or heart disease. Taking your medications correctly is one of the simplest and most effective ways to protect your health. Holding in urine too long in the morning. A hidden health risk. Holding in urine after waking up may seem like a small issue, but it can actually lead to serious health problems, especially for seniors. When you delay going to the bathroom, it triggers the release of stress hormones like cortisol and adrenaline. These hormones increase blood pressure and constrict blood vessels, which can be dangerous for people with already stiff or narrowed arteries. In some cases, holding in urine can even trigger abnormal heart rhythms, putting additional strain on your cardiovascular system. Have you ever delayed going to the bathroom in the morning because you didn't feel like getting up, or you thought you could hold it just a little longer? It's easy to ignore the urge, especially when you're still groggy from sleep. But holding it puts unnecessary pressure on your bladder and increases stress on your body. The resulting rise in cortisol and adrenaline makes your heart work harder and can spike your blood pressure, both of which raise your risk for a stroke, particularly in older adults. I had a patient, Mr. Stevens, in his early 70s, who frequently held in his urine after waking up. He would wait until he felt the urge was nearly unbearable, thinking it wasn't a big deal. After a while, he started feeling dizzy and experiencing an irregular heartbeat. When we discussed his morning habits, we discovered that his full bladder was placing unnecessary strain on his system. After he started responding to the urge to go to the bathroom right away, his symptoms improved significantly. Have you ever felt lightheaded or noticed your heart racing after holding in your urine for a while in the morning? You might not realize that this common habit can have a bigger impact on your health than you think. The pressure on your system, combined with the release of stress hormones, can lead to longer-term health issues if it becomes a routine. The solution is simple. Listen to your body. If you feel the urge to go to the bathroom, don't wait. Get up and go as soon as possible. Holding it in only puts extra pressure on your bladder, which in turn stresses your cardiovascular system, raising your blood pressure and increasing the risk of stroke or heart problems. I've personally experienced the difference since I started responding to my body's signals right away. I used to ignore the urge to use the bathroom first thing in the morning, but once I learned about the risks, I made a change. Now I go as soon as I feel the urge, and I've noticed a big improvement in how I feel. I don't experience dizziness or discomfort anymore. Do you tend to hold off going to the bathroom in the morning, thinking it's no big deal? Pay attention next time you do and notice how your body reacts. Responding to those signals is a simple but effective way to protect your heart and brain. Remember, it only takes a few small adjustments in your routine to protect your brain, heart, and overall health. So, whether it's changing how you get out of bed, staying hydrated first thing in the morning, or being mindful of your medication, these little steps can have a big impact on your long-term health. If you found today's video helpful, don't forget to like, share, and subscribe to our channel. By doing so, you'll stay up to date with all our latest health tips and tricks. We love bringing you useful content, and your support helps us create more videos just like this one. Take care and see you in the next video.